Hi everybody and welcome to my channel tabibi. This video of mine is about rabies. Earlier I posted a short video about this illness on my channel. I hope you have already seen that video. And in this video I will discuss this illness in detail. So let's start the video. Rabies is a deadly virus spread to people from the saliva of infected animals. The rabies virus is usually transmitted through a bite. Animals most likely to transmit rabies in the United States include bats, coyotes, foxes, raccoons, and skunks. In developing countries of Africa and Southeast Asia, stray dogs are the most likely to spread rabies to people. Once a person begins showing signs and symptoms of rabies, the disease nearly always causes death. For this reason, anyone who may have a risk of contracting rabies should receive rabies vaccinations for protection. Now let me tell you the symptoms of rabies. The first symptoms of rabies may be very similar to those of the flu and may last for days. Later signs and symptoms may include fever, headache, nausea, vomiting, agitation, anxiety, confusion, hyperactivity, difficulty swallowing, excessive salivation, fear brought on by attempts to drink fluids because of difficulty swallowing water, hallucinations, insomnia, and partial paralysis also can occur. You should seek immediate medical care if you are bitten by any animal, or exposed to an animal suspected of having rabies. Based on your injuries and the situation in which the exposure occurred, you and your doctor can decide whether you should receive treatment to prevent rabies. Even if you are not sure whether you have been bitten, you should seek medical attention. For instance, a bat that flies into your room while you are sleeping may bite you without waking you. If you awake to find a bat in your room, assume you have been bitten. Also, if you find a bat near a person who cannot report a bite, such as a small child or a person with a disability, assume that person has been bitten. Now let me tell you the causes. Rabies infection is caused by the rabies virus. The virus is spread through saliva of infected animals. Infected animals can spread the virus by biting another animal or a person. In rare cases, rabies can be spread when infected saliva gets into an open wound or the mucous membrane such as the mouth or eyes. This could occur if an infected animal were to lick an open cut on your skin. Now I'll tell you about the animal that can transmit the rabies virus. Any mammal, an animal that suckles its young, can transmit the rabies virus. The animals most likely to transmit the virus to people include the pets and farm animals. First I will tell you about pets and farm animals. These include cats, cows, dogs, ferrets, goats, and horses. And now I'll tell you about the wild animals which can transmit rabies. These are bats, beavers, coyotes, foxes, monkeys, raccoons, skunks, and woodchucks. In rare cases, the virus has been transmitted to tissue and organ transplant recipients from an infected organ. Okay, so these were the causes. Now I will tell you the risk factors. Factors that can increase your risk of rabies include traveling or living in developing countries where rabies is more common, including countries in Africa and Southeast Asia. Activities that are likely to put you in contact with wild animals that may have rabies, such as exploring caves where bats live, or camping without taking precautions to keep wild animals away from your campsite. Working in a laboratory with a rabies virus. Wounds to the head or neck which may help the rabies virus travel to your brain more quickly. So these were the risk factors. Now I will tell you about the preventions. To reduce your risk of coming in contact with rabid animals, you should vaccinate your pets. Cats, dogs, and ferrets can be vaccinated against rabies. Ask your vet doctor how often your pets should be vaccinated. Also, you should keep your pets confined. Keep your pets inside and supervise them when outside. This will help keep your pets from coming in contact with wild animals. You should protect small pets from predators. Keep rabbits and other small pets such as guinea pigs inside or in protected cages so that they are safe from wild animals. These small pets cannot be vaccinated against rabies. Also, you should report stray animals to the local authorities. Call your local animal control officials or other local law enforcement to report stray dogs and cats. Do not approach wild animals. Wild animals with rabies may seem unafraid of people. It is not normal for a wild animal to be friendly with people, so stay away from any animal that seems unafraid. Keep bats out of your home. You should seal any cracks and gaps where bats can enter your home. If you know you have bats in your home, work with a local expert to find ways to keep bats out. Also, you should consider the rabies vaccine if you are traveling. If you are traveling to a country where rabies is common and you will be there for an extended period of time, you should ask your doctor whether you should receive the rabies vaccine. This includes traveling to remote areas where medical care is difficult to find. Now I will tell you about the diagnosis of rabies. At the time a rabid animal bites you, there is no way to know whether the animal has transmitted the rabies virus to you. For this reason, treatment to prevent the rabies virus from infecting your body is recommended if the doctor thinks there is a chance you have been exposed to the virus. Treatment. Once a rabies infection is established, there is no effective treatment, though a small number of people have survived rabies. The disease usually causes death. For that reason, if you think you have been exposed to rabies, you must get a series of shots to prevent the infection from taking hold. And I'll tell you the treatment for people bitten by animals with rabies. If you have been bitten by an animal that is known to have rabies, you will receive a series of shots to prevent the rabies virus from infecting you. If the animal that bit you cannot be found, it may be safest to assume that the animal has rabies, but this will depend on several factors such as the type of animal and the situation in which the bite occurred. Rabies shots include a fast-acting shot, which is rabies immune globulin, to prevent the virus from infecting you. Part of this injection is given near the area where the animal bit you, if possible, as soon as possible after the bite. A series of rabies vaccinations to help your body learn to identify and fight the rabies virus. Rabies vaccinations are given as injections in your arm. You receive 4 injections over 14 days. Also, if an animal bites you, you should seek medical attention for the wound. Also, tell the doctor about the circumstances of your injury. Usually, we ask what animal bit you. Was it a wild animal or a pet? If it was a pet, do you know who owned the pet? Was it vaccinated? Can you describe the animal's behavior before it bit you? Was the animal provoked? Were you able to capture or kill the animal after it bit you? You should wash your wound gently and thoroughly with soap and generous amounts of water. This may help wash away the virus. If the animal that bit you can be contained or captured without causing more injury, do so. Do not kill the animal with a blow or a shot to the head, as the resulting injuries may make it difficult to perform lab tests to determine whether the animal has rabies. You should tell your doctor that you have captured the animal that bit you. Your doctor may then contact the local health department to determine what to do with the animals. So this was my detailed video about rabies. I hope you have found this video useful, and till now if you haven't subscribed to my channel with BB, please do so now, and do not forget to click the bell icon so that all upcoming videos are delivered to your inbox straight away. And if you think that my videos provide some sort of benefit, even it is a little bit benefit, then please do not forget to give a thumbs up to this video. Also, remember that this channel of mine, as known as BB, is basically meant to help humanity across the world. So if possible, please share my videos through social media such as Facebook and Twitter, so that you can help others to spread awareness about different illnesses. Also, if you have any confusion, or if you have any question, or if you want me to make a video about any other illness, please comment on this video and mention about the illness so that I can look into that, and if I get a time I will make a video about your illness, and if I do not find a time I'll try to reply to your comment as soon as possible. Okay, thanks for watching this video. See you in next video. Bye for now.